Welcome back to Good Day. The warning from the FDA about testosterone supplements suggests that they may increase patients' risk for heart attacks and strokes. Here with us now to discuss the new study is Dr. Parviz Kavusi, a reproductive urologist at St. David's South. Thank you so much for joining us this morning.
Thank you very much for having me.
Yeah, so I want to just kind of jump into it and talk about what the study is saying that we didn't already know.
Sure. So there have been 3 studies actually in the last several years that indicated that men on testosterone may be at an increased risk of cardiovascular disease, heart attacks, and stroke. There are an awful lot of studies actually out there on these topics. The most recent ones have been over the last 2 years that showed a potential detriment on heart function. When you look overall at the literature, there are studies that actually show safety. There are studies that show improvement in cardiovascular outcomes. And when we're looking at studies, it's not only important to look at what they say is their conclusion, but how they're done in their methodology. So what I will tell you is that the 3 that really raised a lot of concern about cardiovascular risk, when you actually read through those studies, there are a fair number of flaws and limitations in their methodologies on how they're performed, and that raises a lot of question about the validity of their results. There are other studies which don't get quite as much attention that show a great deal of safety, some that even show improvement in cardiovascular outcomes, but the truth is there's not the perfect study out there. And so we have some good data, some bad data. We've got some controversy on exactly what the outcomes should be. But most of us that read through those and understand how to read them critically will tell you that the ones that show harm have not been done in a manner that really shows that their conclusions are that valid.
Okay, well, tell me, who is at greatest risk for taking this testosterone supplement?
So there are risks that go along with testosterone replacement, regardless of what type we're talking about. Things, side effects that we can see are things like oily skin, acne, breast tenderness, enlargement. There is a risk of increasing red blood cell production in the blood vessels that could potentially put guys at risk of clots. Depending on the modality of testosterone replacement, those risks vary in how frequently we see them, and we monitor all those things. Ultimately, the key is that we're treating the right patients. And so a big concern, and I think this is what really got a lot of the FDA's attention, was that there's data that shows that there are a lot of men, some studies show up to about 25% of men that are being treated with testosterone that never had a baseline testosterone even checked to see if they're truly low. So the key is having a physician or a provider that's well trained and understands the disease process, understands who should be treated, how to evaluate them, to do a good history, a good physical examination, get the appropriate labs, and then have a very in-depth conversation with the patient about potential benefits and potential risks, and what we really understand based on good studies to help us advise our patients to help them decide, is this the right treatment for them or not?
Right. Well, I've seen some of these studies before, and I just want to know, what is an average testosterone level for men? Because I know that, they get worried when it's, a certain number, but they really shouldn't be. So kind of tell us a little bit about the numbers there.
That's a really hard question to answer. Okay,
I knew it. That's why I asked it.
It's a great question. The reason it's a hard question to answer is what we call normal is anywhere between 300 and 1,000 nanograms per deciliter in the blood. I would challenge you to find any range of normal that wide in medicine for anything else. That's a massively wide range.
That's a huge range, 300 to 1,000. Okay.
So the reason we got that is we checked levels in guys at their peaks, and they fell between those levels. So really, this is more of a clinical diagnosis that the numbers help us with. If we go strictly by endocrine society guidelines, they will tell us that anybody below 300 is low, everybody below 300 is normal. There's a lot of debate and controversy about that too, because each guy probably has a threshold where above that they're optimized and below that they're not. So we look at that patient as an individual, we go through all their symptoms, see if their physical exam matches the possibility they may be low, and then we evaluate them with at least 2 sets of blood tests to see where their testosterone ranges, because the level won't be the same every day. There's a fair amount of variation. That helps us understand what range that guy lives in to know, is he really a candidate for treatment or not.
Okay. All right. Well, if they want to learn more about this, where can they? Because I know that this is something that is probably going to spark some interest here. So where can they find out more?
So the American Urologic Association website, our practice website at austinmenshealth.com has an awful lot about this. And it's really important for men to be educated on it appropriately and then get an evaluation by somebody that's really well trained in this field to give good management from there.
Okay, well, Dr. Kavusi, it's always a pleasure having you on the show. Thank you so much for that info.
My pleasure. Thanks.